welcome every one of us to this meeting. My name is Dr. Mrs. Orievan, the Research Specialist, CEO of Nataf & David Consulting Limited. A little introduction of who we are. Nataf & David Consulting Limited is a leading provider of solutions and expertise across a number of industries, including human and manpower development, operations and strategy, research and business reengineering, amongst others. Today we are presenting Health, Safety and Environment, Enclave, with a theme, Essential Materials in Health, Safety and Environment, to aid efficient operation and growth. The first session we will be dealing on is HSC in Nigeria, the essentials and perspectives. And the second session will look at the safety in construction, manufacturing, oil and gas, and all that. What we need to do and what we must do. Once again, I thank you for the time to be here. We have professionals who will be tackling the topics that we have. We have professionals, Mrs. Antonia Berry, who is the Technical Director of Safety Consultant and Solutions Providers. We have Mr. Max Uneke Friday, the CEO and Managing Director of Unitronics Global Company Limited. We have Fayo Williams, the founder and MD consultant, Simply Exponential Consult, and Director, Reliance Supply Limited. You're welcome. Antonia Berry is the principal founder and lead consultant and technical director of Safety Consultants and Solutions Providers. She has championed the bridging of the knowledge and skill gaps through training in corporate governance, capacity building, consultancy, standardization, and advocacy. The risk management solutions she provides target public and private sector initiatives, and they are strategic and particularly important for compliance, regulation, and business continuity. She leads an organization that seeks to advance the highest standards of regulation and education by promoting best practices in compliance to local and international codes through the provision of professional compliance safety solutions and certification. CSSP partners with regulatory bodies, public and private sector enterprises committed to best practice in life and safety risk management. Her capacity building goal is to ensure a sustainable pool of over 500 well-trained emergency response personnel annually to strengthen the sector's ability to respond efficiently and effectively to all crisis scenarios, thereby reducing incidents of loss of lives and property when such events occur. Equally, this will ensure reduced exposures to risk that creates disruptions to business continuity, restore investors' confidence, and drive sustainable private sector growth and inevitably economic development. To this end, she manages and runs a business that serves both for good and for profit, training numerous professionals with a perspective of sustainable economic development, the safety perspective. Mrs. Anthony Berry, you're welcome, ma'am. Good morning. And I have other speakers. I have Max Uneke Friday. I will just also give a little introduction on his profile. Max Uneke Friday is a seasoned QHSC officer, ISO auditor, entrepreneur, mentor, professional trainer, business strategist, leadership and management consultant, and a writer, with an experience spanning over the years in highly established business, companies, organizations, and associations in high managerial positions. He remains up to date with technology of the day in offshore oil and gas management, quality, health, safety and environment, ISO auditing and certification, professional trainer, quantity surveyor, civil engineer, building construction, renewable energy, business administration, leadership, coaching and mentorship, research, journal management, consultancy, and related fields. All these are the things that Max Uneke Friday is involved in. He holds an HND in quantity surveying, mini MBA in business administration, PhD and MSc oil, gas, and energy management from South Africa University and Delaware, USA. He is the CEO and Managing Director of Unitronics Global Company Limited, Max Traco Construction and Resources, and Max Medage Technology and Consulting Limited. He is a member of the Nigerian Institute of Management, Associate of Cost Analysts of Nigeria, Onshore Offshore Oil and Gas Professional, Association Entrepreneurs and Technologists of Nigeria, World Safety Organization, and Nigeria Institute of Quantity Surveying. Mr. Max Uneke Friday, you are welcome to this conversation. Thank you so much for your time to be here. So with all these experiences over the years in established business companies, organizations, associations, in managerial positions, he remains up to date with technology of the day in quality, health, safety, and environment. You are welcome once again. And I want to introduce our next speaker, Pam Fire Williams. Pam Fire Williams holds a B.Pharm MSc, and she also holds some. You're welcome, ma'am. Thank you. You're welcome. MAW FIMCB. She's an International Labour Organization member. She starts and improves any business. She's a master trainer and certified management consultant with background in pharmacy. She's the founder and managing consultant of Simple Exponential Consult Limited and serves in the capacity of director in a health and safety company. She volunteers at Lagos State Ready Set Work Initiative. She's a presenter, safety trainer on Lagos Traffic Radio for over 5 years, and the first vice president, NECA's Network of Entrepreneurial Women, for over 6 years. She also mentored an all-female team who won Angel Hack 2018. She's a multi-award winner, WSO SEFRA Ambassador, Nigeria Safety Award for Excellence Niger, Commendation Award, and two-time winner of Nigerian Safety and Security Magazine's Safety Amazon Award in 2014 and 2018. She was recently appointed Director, Partnerships Innovation Support Network Corps, and was awarded the grade of Learning and Development Specialist by Learning and Development Network International. She has facilitated at numerous workshops on child care, entrepreneurship, teacher training, over 500 trained in Lagos Eco projects. You're welcome, ma. She's a council member of the Lagos Chamber of Commerce and Industry and has been featured by Facebook's She Means Business. Pam Fire Williams, you're welcome, ma. Thank you for taking out time to join us in this conversation. I want to make a last but not the least introduction of my CEO, Mr. Kenneth Stevenson, Odushola Stevenson. I'm not sure. I think he's been around. He's the CEO of Nataf & David Consulting, and he also sits in the board of other companies, including Inside Business Africa, the CED magazine, and he's the chairperson and CEO of Systems 21 Century Systems. You're welcome, sir. Without wasting time, I'm going to call on Mrs. Antonia Berry to come up.
Good morning, all.
Okay, good morning, ma'am.
Yes, Ovi and everyone, thanks very much for the invitation to speak on this forum and have this dialogue. Because the session will be quite interactive, I will solicit your understanding in unmuting the team members so we can have a conversation, as you have aptly described this session. Yes? For this morning, we're looking at a conversation on HSE as a sustainable economic development driver. Where do we come in? Where do we stand? And how what we do can impact and change the level of development long-term in our communities. The main thrust of what I'm going to discuss is the conception of HSE that we have that negates our effective contribution to sustainability and development within the African continent at large. I have heard different definitions of HSE, but we tend more not to be seen as part of a risk management chain. When we were studying HSE, we were told we start from concept to decommissioning. What does that mean? You take the master planning of a city. You have the zoning for purpose or use purpose or statement of use. You have the road infrastructure. You have the water distribution. You have traffic regulations. We as HSE people start at that concept, vetting plans, so that when they're investing in the structure, HSE is embedded. At the end of the day, it is for the people, for the well-being of the people. That's what the government says they're championing. We are not limited or included in that phase, which is the key master phase of any project. It defines the rules of engagement on any project. Where they have conveniently placed us and we are comfortable staying is in the execution. So you see an architect designing a building. People are doing IAs. People are asking, who are the people that are going to occupy these buildings? Few people are doing the life and safety master plans. Few people are doing the structural integrity against collapse. The architect builds, it looks good. There's no safety imbibed. You start building this thing. You find the investor saying, no, this wall, there's no air coming through. The quality of living, the user's safety was never taken into account. The windows are too low. We're building too close to the roads. What could have happened from concept were involved to help guide a strategic aspect of it, which is designed for fitness purpose and with the user's HSE considerations in place. No, we get to side, they tell you, HSE, what are you doing? Wear your PPE, do this. We become more in the mediocrity of saying we're managing site risk. I say my job is a lot more than that. My job is in the concept. I should be able to look at a project and say, for this project, this is the kind of HSE person you will need to minimize risk. And that goes into hiring the HSE person. When the building is built, we now focus on engineering. Oh, let the engineer design this, design that, without any compliance benchmark built in the initial engineering package or in the initial concept by the architects. Guess what? At that point, the cost of a good hydrant or fire protection system was never factored in. You're now asking your client who has generated a budget to go looking for money. Of course, the safety cannot be put in at the 20 feet position. So it's not brought in, it's not imbibed in our building codes, which are core mandates to ensure we're not build breaking down. If you relate even to the government, you see beautiful highways. A highway should have an electrical channel, should have a water channel, so that when I get to my destination, I can have the same quality of water I have in VI in Epe. You have these huge road expansions. The people living in Epe or in Aja or in Shango Tedo are not considered. Why say that? How are you one day going to take water there without breaking what you have built? No, we're not considered. But for the welfare of people in Epe, they need treated water. Where is the water tank? What was the distribution made? As you're building roads, you must consider the welfare, the health of the people, and you design services into this. It's not about the tar. It's not about that at all. It's about where is the electrical channel that will allow to hang wires. Who verifies that in the planning? Nobody. But we are now called to do the wires and start flying them over. And we talk of safety and we talk of development. No, of course, the World Bank comes back and says, no, this is not a compliant road. In fact, it's very dangerous because guess what? This pole can fall over somebody's head, right? And say, no, 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 no. We gave you money, you wasted the money. Safety is not imbibed at concept for sustainability and growth and continuous development. So we void compliance mandates. We void user HSE mandates from inception. We need to stop working in the middle, but we have to work from the beginning to the end. You go on a road, you have all the exits that were built in Lagos. You had all the beautiful roundabouts. Only God knows how much money was spent. The welfare or the safety of the people should have been considered. They should have put in the traffic from day one to manage traffic control. They built the roundabouts. They said, oh, we're developing Lagos as a mega city. Guess what? No. If I have to live in a mega city and do 4 hours of traffic, I would prefer to live in my village. What was missing? Did you look at travel plan, travel time for the residents in that area? Did you consider the effect on their health, the effect on their families, the security issues that are raised by being stopped in traffic up till midnight? When the government is planning, where is safety in all of that? So you can see that because safety is not imbibed in concept, in planning, in design. Yes, they built the beautiful roads, they've broken them down. The next budget is going into roads again. Let's wait and see. Even in all that, you did not put a gutter. You have not identified where you put the water tank. As you're laying that road, please put a pipe. One day when you get to my door, give me clean water from the state. That is my health issue. We are operating as managed governments, local government on our own. We provide light, we provide water, we provide our security, because the basic safety tenets that are meant for comfortable living, I'm not asking for more than that, are not considered in concept and design in the global master plan. So safety needs to be engaged at the global level for sustainability. Else, we will run the same riot year after year, building and breaking, without any concrete development from phase 1 to phase 2. Now I call on safety professionals, which we are. Then we must query ourselves. Please, is my job just to go and design a hydrant, or is my job to make sure that this house is not building a tank, but that they should be providing water from the mains? Every day we see facilities, oh, build your own tank. It's become such a custom. No, it is wrong. I cannot be safe if my neighbor is unsafe. So a lot of these things, we need a coalition that says, listen, basic infrastructure, not everybody can afford a water tank. Not everybody can afford a pump. Maybe we need to get into community service to say, no, this should be provided for us from a common ground. I can afford a hose reel. It's 100,000. But guess what? I can't afford a pump of 10 million. But so we should stop doing or convincing ourselves that we are creating safety and safe environments for unique individuals. Safety is community-based. The fire in my house will definitely affect my rich neighbor. Let me tell you, if he doesn't burn it down, he will get the smoke. But could that have been contained? Am I giving him a false illusion that he is safe if I continue and condone the practice of self-safety, not community engagement and safety at large? So it is a misrepresentation by a lot of us, and I'm guilty of this as well, that we convince people that they are safe. Now let's look at use. Let's look at maintenance. Everybody in Orile is maintaining extinguishers. I can assure you there's no standard to it. The powders are not filled to capacity. The CO2 is maybe empty air they are putting in. You try using them when disaster calls. Where is the regulation? Okay, so maybe I even did the right thing in concept and I designed well and it's working. Who regulates the professional? And I call on everybody, and you can quote me anywhere. You now have government institutions like Lagos State Safety Commission and all the other commissions. They are the ones, instead of doing policy, they are the ones nominating consultants. Where is where is the independence in compliance? I will nominate you to go and be. I am the one writing the standard. It's unheard of. Yes, in a society where acting is wrong. There is no way you can talk of effective contribution without having policy makers different from the executive arm. It should be very clear. Where do you now have the fire service going to be servicing extinguishers or hydrants in facilities they should be protecting? Where does their job lie? And we see it every day and we laugh about it. We say, yes, I'm making money. The question is, when we talk of growth and development, we as practitioners have so bastardized, excuse my word, the profession that we have become inefficient in contributing. And it is becoming more evident that we must rise to a certain level of ethics and integrity in the practice. For even the society to consider it, every default graduate who cannot find a job becomes a safety officer. It is not because of love of the profession. It's because it is the easiest profession where people come in. But guess what? The benchmarks for entry into safety are actually very high. What did you practice? I went to, I did NYC, then I did a safety course in. Well, that is how we're getting our professionals. Now, we have competent trainers like Mrs. Fire Williams, whom I've sat in for training. Why are they not the ones defining the benchmarks for safety training in the country? Why don't we have all that? Why must it be some agency imposing it on me rather than a qualified practitioner who represents the safety mandates to make sure that they are properly applied? So from that to maintenance and use, there is even no qualification system. There is no compliance benchmark. In my candid opinion, there's no regulation. Regulation in safety is educational. It's seeking my buy-in. I see the case of it is now a mandate, you must use your mask and all that. I dare tell people safety is imbibed when the value is understood. You cannot love me more than me, to forget. You can think you can, but you cannot love me more than me. I have every interest in staying alive. What if we were doing education of the people? People will appreciate these things more. But when you come to the rule that if you're crossing the road, you will be accosted, those are meant for people who are non-conforming in society that we call people who have psychological issues. When you see somebody crossing an express, you should be worried about their mental state. Not trying to punish them. There's something fundamentally wrong with you if you saw an overhead bridge and you were crossing an express. But guess what? It's a means for making money. It's not a means for counseling. It should be a means for counseling. It shouldn't be about making money. Because when you see one dead body, on that week, nobody will cross. But coming the following week, maybe what we should have done was put a sign on the road. High speed area, avoid crossing. Rather than calling the person, because the next person could still do that. Now, the traffic situation in that junction is understood that cars tend to speed up here. This is a high risk area. Where are the signs on the road? But you have the audacity to give me a ticket and say you're taking me to psychological ward without protecting the rest of society. So how are we developing all this? Now, you go even from use, you have the road and all. When they start decommissioning, you know, the law allows me to, I have to go and get a building permit and all. Decommissioning, I can just break the building. I'm breaking the building, structural constructs around me. Where I live, I have a big church. Man, this is a residential area, but the church is so huge. I suffer from noise every Sunday. There are zonings and considerations for all. Well, they have the money to get the permit, so what can I do? So guess what? Every Sunday morning, I will tell everybody, please don't visit me. You will be a miserable person. Not only when they were building, they didn't look at drainage. You know, when you have a large expanse of land and you slope it to somebody's place, now I have flood every time. They should have been, when you're looking at design, check the gutters. Short of that, maybe I need to break the building and move, but you know, I can't afford it, so I'm stuck with it. Practices we do. Where are we? We're only seen as those people that say, use the fire extinguisher. Believe you me, safety is more than use fire extinguisher. Safety is a mindset, is concept. I am as valuable at the beginning of a project as the architect, and I am as valuable at the end of the project as the project engineer. I have an important contribution to make. So my call today is for us to really grow, we have to look at safety as part of the risk management chain. Where does my job stop? When I hand the residual risk over to the insurance company. So guess what? I am a chain of insurers. I insure the safety. What I cannot insure by knocking it out, insurance gives you a premium. So safety experts are meant to be underwriters for insurance. Insurance is not all commercial. You sit in cases where buildings burn, they call you in, guess what? You will pay the premium. You collected money to say, put a sprinkler, put a sign. Guess what? You did not use the code. You did not define what a sprinkler is. As long as it sprinkles water, whether it is okay or not, it's sprinkled. So the insurance will be losing money. Why? They don't even see us as core members. Else, a lot of these buildings burned would have premium to give income to start again. And that is the security people are looking for. Until they see us and we see ourselves as valuable members. I will summarize by saying there can be no sustainability. There can be no positive growth or continuous in our environment. So I don't know if you have anything to add or questions to ask. I would gladly take them. Right, Obi? I think I've done 15 good minutes, yeah? So that's my sharing with you for today, my conversation.
Okay. For me, let me say a very big thank you. I don't know if Mrs. Van is here now, but for me, I think I think I am quite comfortable with the narrative you have just put on. I hope you're hearing me, Mrs. Berry.
Yes, I am. Yes, I am. Thanks.
Okay, I think I'm quite delighted that you started this conversation in this manner. Because what you have decided to do is to point at what is needed, where we ought to be, and what we are not doing right. Mm-hmm. I think that's just the basis of your conversation, which is very, very key to this entire conversation about health and the environment. Some of us, that studied overseas, we drive on the main road, before you see a water hydrant somewhere, all right? I'm not sure I've seen anyone around in Lagos, all right? Because, but these are things that when you drive on the highway or anywhere, you can actually, anything happens to see a water hydrant somewhere, and then you can actually take care of it. However, but in Nigeria, just like you have said, which is very, very apt, the planners, the designers, or what you call it, architecture, they hardly input health, safety, and environment. At least, more percent of the fire extinguisher, and is key, because it's not to know how to use the fire extinguisher when something happens.
Thank you so much, Mrs. Berry. Fire Williams, are you around now?
Yeah. Good morning, distinguished ladies and gentlemen. I would like to thank the chairperson, the chairman of 21st Century. He's been so kind, in moderating and directing this event. And I would like to thank the speaker who came before me, Antonia Berry. She's such a lady who is passionate about safety, who is endowed with great integrity and vision for this profession, and I just want to salute her and to say that together we will all get there. So the topic I've been assigned to treat is HSE in the new normal, strategic approach and delivery, and this is still in line with the theme of essential materials in health, safety, and environment to aid efficient operation and growth. And I will just say that I agree with all, Antonia had said before me about people valuing safety. I was monitoring a program on radio, and the Railway Corporation were being asked about rooftop riders. So if Antonia is saying we should send those who run across the express for psychiatric evaluation, what do we do to those who are sitting on top of a moving train? If that is not committing suicide, then I wonder what else
Yeah.
is akin to committing suicide. So, having said that, we just need to look at the effect of COVID-19, on the local and international scale. On the local scale, I would say it's just the Almighty who has been our helper. I would virtually say that. Because ever since the NSAS protest now, it's like people had something else to think about and they've thrown all caution to the wind. So I want to reiterate it that COVID-19 is still very much with us. Without going into Mr. Mark's his own area, I would like us to realize that this issue of the new normal, of COVID-19, of heightened awareness on anything personal hygiene may need to be a part and parcel of our lives even in 2021. Now, secondly, business operations and the way we perform our job roles have changed. So you now have a safety officer, like in an oil and gas company that I consult for, he's at home worried about the health of those at home. When they were in the office, it's a different thing. He's telling them, oh, no smoking here, don't do this, don't do that. But now at home, he doesn't know what they're doing. Some of them are damaging their backs, having musculoskeletal disorders due to wrong ergonomics, and so on and so forth. So I would like to put forward my prescription. Under HSC in the new normal, strategic approach and delivery, I would like to propose personal responsibility for safety. And I would like that to begin to be our mantra. Having a personal responsibility for safety is what can work now. Because we are not going to have police, face mask police, or hand washing police, or business continuity police. Some people woke up on the 21st and found out that they don't have a business anymore. Some of these people, like Antonia rightly mentioned, did not have insurance, did not think of business continuity. And so we must have personal responsibility for safety. And the president had said this in one of his addresses. We may have lost it because there are so many things we are complaining about, we know. But it's still something that is very, very much on the front burner, and we all need to adhere to it. Now, some companies have taken steps to organize remote working, others have not. Even as an SME, I have done what they call drawing up a small policy, and you may need to give a small stipend so that people so that people can know that you support them in working remotely. It's very, very necessary. The staff need to know that they have your support. Now, the pandemic has introduced new health and safety risks, even to the designated first aider. The designated first aider in every workplace now has to treat a potential patient as being a COVID patient. There are new guidelines from ILCO, there are new guidelines from European Resuscitation Council, and of course, a lot of countries like the UK and the American Heart Association have released their own guidelines. Mouth-to-mouth resuscitation is no longer being done. So you were talking about the new normal. So the new normal now is for us to treat anybody who is not your household contact as a COVID-19 patient. That is the new normal. So you have to have your PPE, your mask on you, and the mask on the victim. Even the victim has to wear a mask for you to be able to approach safely and do your primary survey and then see whether you can assist. Now, let us look at strategic approach so that we don't end up, maybe just distressing ourselves about this new normal, which there's nothing we can do. We have to live in it. Maintaining and updating your business continuity plan, your BCP, is essential. What are your objectives? What is the plan B? what are the operations most at risk? So if you have some on-site operations, including manufacturing and so on, those are going to be the most at risk, because to do them, many a times you have to be physically present. But I was very pleasantly surprised. A friend of mine had a breakdown on his laptop, and he was asked to download a particular software. I think they call it AnyDesk, and remotely an IT personnel had full control of his desktop, my documents, his RAM, and every other thing in that system. So my charge for business continuity now is that you need to digitalize your business. If anybody is listening to me right now, we're happy that we've been in the throes of one Zoom or the other. Zoom is just a small part of it. I run a hub as well as the health and safety business. Very recently now, I've found an online software to do my booking, so that from wherever I am, you can book people in spaces. There'll be no clashes. We all have to find out ways to digitize our business and digitize our business safely, giving the right guidelines, the use of the DSC exposure to monitor, avoiding repetitive strain injuries in work at home workers, remote working personnel, and so on. We have to put this in place. Now, we need to have clearly defined roles and responsibilities. For many people, this is key. It's easy to get subsumed in a plethora of challenges, in a plethora of new normal guidelines. It's easy to get subsumed. Who does what? Let it be clear in our organizations in order for us to foster growth. Now, we need to conduct risk assessments frequently. There are guidelines and templates that can be found on OSHA and HSC websites. Okay, there are resources in place. So as we do a workplace inspection, you should also have your home inspection. I am someone, I'm not proud to say this. I had a trip at home once that left me a broken tibia, and I was out of action for 12 weeks because I was in a bit of a haste. So I can imagine if you are working now remotely and you have the children around you. Thank God schools have reopened, but you have the children around you. You have a lot of duties to perform on the elderly, on other members of the family. You have to adopt a new mindset of better care. And that is what we are facing right now. Now, we need to have all the non-pharmaceutical interventions, whether at home or at work. In my own house, right from the entrance, we have a sanitizer bay. And of course, as per workplace guidelines, you have to have that all around you. So don't let me encroach on what Mr. Max is going to say. Now, we need to redesign work patterns. I had mentioned this issue of jobs requiring physical presence. Remember, rotational shifts can be brought into being. One group does not have to meet another. We also run a public-private practice, and we have shift system, a 24-hour service in a pharmacy. So what we had to do during the curfew was to do some redesign of the shift system, the work processes. And when the curfew was over, some of those who had stepped in to do more than their fair share, they were given a day or two off. So we really need flexibility. So just to recap, taking personal responsibility for our safety. Secondly, having a rethink of our work processes. Thirdly, we spoke about the business continuity plan, updating it consistently and making sure you are in line with the new normal. And then we spoke about digitization. If somebody remotely can repair my system, then what are we talking about here? We need to find out as much automation as possible so that we can get these things done. Now, training and retraining. It's unfortunate that whenever there is a challenge, Training budgets, I'm sure Antonia will bear me witness, is one of the first to be cut off. And this is going to be such a shame because honestly, training resilience, training in safety practices for the worker personally and also for the workplace is essential. Having a resumption plan, communicating it is essential. And looking at issues like mental health, emotional intelligence, they are so essential. So the safety consultants like us here, we are open to investigating what the challenges are in various organizations. And we hope that the government will back off and not take this role along with that of regulators, just as Antonia had mentioned earlier. Now, how can we stay on top of this new normal? Can we practice a daily check-in and have some weekly planning sessions so that we keep on having our workers, all our workers in the loop of things? With technology, Google Meet, GoToWebinar, the Zoom facilities, video conferencing, this should be easier. This should be easier done. And in conclusion, I will say it's important for employees to work together. It's important for employers to work with employees. It should be more of engagement, flexibility, re-strategizing right now in order for us to be able to function efficiently in the new normal. Everyone needs to think creatively. There must be what we call critical thinking being taught in the workplace. Critical thinking and problem solving. That is another skill that we can also pass along on an e-learning platform. Because right now you'll be confronted with things and the worker needs to know, how do I overcome this? Finally, I would like to implore us all to sit back and look at the silver lining in this cloud of the new normal. There are opportunities for self-development. There are opportunities for growing our relationships, for holding family and friends dearer and closer because we have some restrictions. We've had some. We're still having restrictions up till now. I know a curfew is in place. So this is a good time to hold our friends and family close to us. Learn whatever skills you need to scale the new normal. And I pray that this too shall pass. And one day again, we'll all be able to not just e-hug, but physically be in a position to hug like Dr. Orievan. Looking forward to meeting her, hugging her one of these days, and also entrenching the right. There we go, doctor. Entrenching the right safety behavior in the workplace in order for us to achieve efficiency and growth. Thank you very much for listening.
Thank you so much, Faye Williams. I hope to meet you. I know your office is not far from my office, so don't worry. I'm going to come around one day. And however we're going to greet, we're going to greet. However we're going to hug, we're going to hug. Anyhow, yes. Thank you so much for this insightful presentation you have done this morning. In fact, I've learned so much. You talked about us. Importantly, propose personal responsibility for safety. That is key. I think that's what I'm going home with today myself. I hope every other person goes home with that. Everybody should be able to be responsible for your safety. I visited a company yesterday, and the lady said, the owner of the company said, I don't know how I'm going to do this. My workers do not take safety important. I bought the shoes, the helmets. They turned the helmet to plates for eating amala and ewedu. They now turn the shoes, they cut the shoes open and it becomes a sale pass. Then unfortunately, one of them had an accident. Something fell down from the up on his feet and the bones were broken. And the guy is like, oh, I cannot do this, I cannot do that. And the woman said, but you caused this problem for yourself because you refuse to use the safety boots and they would rather wear bedroom slippers in the place they are manufacturing what they're manufacturing. And I told the woman, I said, you know what? At times you want to you are safety conscious, yes, but you need to enforce that, because she now told me that the cost, the health cost, the cost for medication, she bought the cost. So she bought the cost for the medication, she bought the cost for buying these safety materials that are not being used. So we need to enforce that. We need to enforce that. Thank you so much. That each of us must be responsible for our safety. And one of those things she also said is that we should draw up a policy and give stipends. We draw up a policy. It's not just enough to draw up a policy. It's also that we must enforce the implementation of that policy. And then she gave us a lot of strategies, and all that, maintaining your business, trying to do a whole lot of things, getting trained, have a guideline on safety and all that for your workers. I want to once again say thank you so much, Fam Faye Williams, for this session that you had with us. If you have anything to say, just raise your hand up, or you just type it on the chat, then we can respond to that. I want to again thank Mr. Uneke for your patience. Thank you so much, Max Uneke Friday of Unitronics Global. Please, can you come up again for your talk?
Once again, I will first of all want to appreciate the organizers of this program, and also the speakers, because we are all in this together. And most importantly, Mrs. Antonia and Farm and all that. I heard what they say, and I totally concur with them. Okay, especially that Antonia, he was talking about construction considerations and all that. And having come from a construction industry, oil and gas industry, and also technological industry, has been able to expose me to certain things. But then, because of what I have been exposed to, I can comfortably tell you that they are correct to some extent. However, sometimes these days, they try to consider the much they can, but sometimes clients may not be able to afford the cost of consulting a safety officer during inception. These are some of the challenges we normally face in the construction aspect of it. Okay, when the building has been design approved and you get to site, that is when a safety consultant will start telling you this and all that. But those who understand the importance will always look at it as a very important part. Okay, let me go back to where I was. And like I said, I was expected to talk about the pandemic. We say stop the pandemic, and of course, safety and health at work to save lives, and also how do we prepare to come back to work. And I love the part that he talks about the new normal. Okay, this is something we have come to see, and we are going to embrace it. Okay, first of all, I want us to have an overview of what we call the pandemic. We have pandemic, and we have been, this COVID-19 is not actually the first one. Okay, we have been having series of issues like Ebola, cholera. I remember when HIV came and all that, SARS and the rest of them. So now some of these things has been coming from time to time. At the time, the particular situation we find ourselves is completely different from what we used to have, which is the COVID-19. And of course, that is the thing on the lip of everybody. So we are directly or indirectly going to be focusing on the COVID-19 pandemic. Okay, now what is the dynamics of this COVID-19? How does it come? How is it happening? We say that normally any pandemic will first of all start from the emergence in a community, a small community. Okay, from a very small community, like the case of COVID-19 came from China in 2020, January 2020. And of course, on 11th March 2020, it was declared a pandemic. So now what we are saying is that sometimes this thing emanates from a small village. And in safety, we are able to understand that there is no environment. There is no barrier when it comes to environment. What that means is that irrespective of the fact that it's happening in any part of the world or part of the country, it will not take time for it to move from one part to another. So in that case, when it comes out from that small community, we have an outbreak locally. It transmits between people around there. And of course, outbreak amplifies from there to epidemic. From there, it becomes a pandemic. And of course, what do we do, or how does it spread? First of all, integration, global integration, how we are mixed up wherever we are. We talk about travel and of course, urbanizations. Okay. Now it has impacted us seriously. The impact on the world of work, like Mrs. Pham talks about, the world of work, increased unemployment and underemployment. Of course, at this point in time, most of you who find themselves in some organization will remember that some people were sacked. It's not as if the management wants to do that, but then there is no resources to cater for some of these people. Some of them were sacked. Some of them who are working, their salary were cut down because the company cannot be able to take care of them. And some of them, they decided to tell them, hold on, we will come back for you. Also, the pandemic has a way of causing absenteeism. People may not be able to come to work as seen during the lockdown and all that, changing the pattern of commerce. Businesses are changing the new normals and all that, reduce access to social protection. Okay. Somebody wanted to invite me for a wedding few days ago, and when he remembered the number of people that were supposed to attend, they said, whatever you have, you can send from there, because now you cannot even attend a normal social gathering as it ought to be. Now, interrupted supply and delivery. Those of you who are into logistics, companies, and all that, some of them who has goods on the sea, some of them who has some kind of product that are not a COVID-19 product, some of them cannot be shipped in because of the pandemic. Okay, particularly negative effect on specific group more vulnerable to adverse labor market. Okay, this has a way of affecting everybody. But the question today is, why a focus on safety and health at work? How do we focus on it? We are focusing on it because we want to have a kind of identification of who the workers, the occupation and sectors increase that has an increase contagion. Okay, what are those environments? And in this program, I think we are focusing on certain industry like the construction industry, the oil and gas industry, and so many other allied industries. So we want to find out who are these people at the forefront of it. Now, implementation of control and prevention measures. What are the control measures that we need to put in place to ensure that we kick this pandemic out, or we are able to manage it? Okay, based on risk assessment, like they rightly said. Now, dissemination of information, which is one of the things which I believe the organizers of this program considered. How do we educate people? How do we provide information to those who are vulnerable? How do we do that? Okay. Now, what are the occupational safety and health rights and responsibility according to ILO, that is International Labour Organizations? Remember, we are talking about people coming back to work. So what are the standards? What are the responsibilities? One of them is that the employers has a responsibility, and of course, the employee has a responsibility. And in which case, the employer in this case ensures that so far as reasonably practicable, the workplace, machineries, equipment, and every other process required are put in place in such a way that it will not pose risk to the workers. Okay? So that so far as it can be possible, that chemical and physical as well as biological substances and agents are put into control. You don't use them anyhow. Okay? In fact, I remember those days, if they tell you, you use a tissue or wiper or whatever, the way you dispose it, you understand, is something else. Or you sneeze in a public, there's a way people look at you. Okay? So now, it is also the responsibility of the company or the employer to provide where necessary adequate protection, clothing and protective equipment. It is very important that all these things are provided to ensure that these people are safe from this pandemic, and also to ensure that workers and their representatives are consulted, informed and trained at all times. They must be consulted, they must be represented, they must be informed, properly trained. Oh, they are doing a particular kind of job. That is what my colleague called a new normal. Now, you are working within this environment now. What are the things you are supposed to be doing now? What are those things you were doing before that you shouldn't be doing now due to the nature of the job or the nature of the pandemic? Now, when you look at the responsibility of the workers on the other side, you find out that it is a right to remove themselves from work situation which they have reasonably justified that is risky for them. They have the right to do so, right to receive adequate information and the training. Okay, they have the right, which of course most organizations have always organized programs. I have gone to so many companies training them on this same pandemic issue. How do they work within this new normal? So, which means that the management of some organizations are taking it as their responsibility to form this training for the people. Okay. Now, also duty to cooperate with employers. Okay, cooperate with them in any situation. It could be that they find that, oh, we cannot be able to pay, or the salary is being delayed, or we have provided this equipment for you and you're expected to make sure that you use them. So these are some of the responsibility. But then also protecting workers from the risk of contagion during an outbreak. How do we protect them? How do we protect them? Now, it is very important that we look at two things in safety when we are doing a risk assessment. And one of them is what we call probability. And the other one is called the severity. Okay. Now, what is the probability that this person will be exposed? What is the transmission pattern? What is the probability that workers may encounter infectious persons or may be exposed to a contaminated environment or materials, like the laboratory samples, the waste, and all that? What are the probability? Looking at the nature of job you are doing, you need to put that into consideration. Secondly, you need to look at the severity, which is, of course, the resulting health outcome. If this thing should happen, what is the resulting health outcome? Taking into account individual affecting factors like the ages, okay, or underlying diseases and health conditions. Now, it is worthy of note that those who are aged are more easily affected. Okay, those who have previous sickness or illness and all that are also badly affected when it comes. But when you have a good immune system, you have the ability to fight some of these things. So you need to look at the possibility of you being exposed as a result of the kind of job you do. And also you need to look at the severity. Should this happen, what will be the effect? But then it is very important that people know the nature of their job and understand whether they are part of those at the emergency or at the forefront of this COVID-19 or any form of pandemic. Now, some of those people are the health workers, for instance, okay, which we already know. Laboratory personnel, you go to hospital to, check yourself and all that. Death cares, because you don't even know what killed the person. Emergency transport workers, okay. Now, cleaners and so many other people, police officers, civil protection personnel, military personnel, firefighters, and some of these people, they are at the forefront of this fight. Because if you check very well, even during the lockdown, most of them are still working. So what that means is that they are at risk. There's a high probability that these people can be affected over time. That is why they need to be very, very careful. Now, let's also look at the emergency response workers. Who are these people? Who are those at the emergency part in case of anything like the NCDC and all that? Contact with infectious person. These are the people at the forefront, emergency response. These people that have contact with them, okay? Contact with infectious blood or tissues, contact with bodies of persons, as maybe whether the person is dead or not, contact with contaminated materials you see around, okay? Now, medical equipment and all that, these are people who found themselves within that environment. But the question is now, we need to look at strategies. We need to find a solution. And what are the measures? What are the emergency response workers? What are the examples of the measures that need to be put in place? Number one is what we call risk and engineering control. What is environmental and engineering control? Now, this is aimed at reducing the spread of these pathogens and the contamination of the surfaces. How does this pathogen spread? How does this virus spread? What are we going to do to ensure that it doesn't spread within our environment? Like physical distancing between patients and healthcare givers and emergency workers. Okay, when you are talking to the person, you stay as far as you can, because while the person is talking, there are saliva, there are, some other things that is coming out from this person's mouth. And we have seen according to World Health Organization, that this thing can be transmitted through the air. Okay, which is one of the things that make it more dangerous than some other ones like HIV, which the mode of transmission is a little bit controlled. Okay, now also we have what we call administrative measures. What are the administrative measures that we need to put in place to ensure that this thing is done? And this is aimed at preventing the risky behavior, infection prevention control procedures, occupational safety and health training. How do you train these people? What are the procedures that you are going to use? Like my colleague rightly pointed out that they have shifting and all that. What are the procedures? How do you used to do work before now? But now at this point, due to this pandemic, you need to re-strategize. You need to look at what you are doing to reduce the number of people and also to save costs. Now, training and retraining, and also health monitoring and of course, surveillance. Very important we look at that. Then the third one is appropriate PPE. Yes, personal protective equipment. Now, it is very important that every point in time, you use the right equipment, the protective equipment. Sometimes you might think, oh, you are using nose masks. Sometimes you think you are using hand gloves. Okay, I remember when the thing came, something happened in one of the office I went for training. Okay, now people were using, one person were actually using a rubber hand glove. Okay, why coming from house? Because he wants to protect himself. You come with a rubber hand glove and you get to the office, and while you were on the way, you are touching cars, you are touching different surfaces, and when you get to the office, you still wear the same hand glove, moving up and down. What that simply means is that you are protecting yourself, but you are not protecting the entire environment, those who are working with you. Because if you have come in contact with this COVID-19 while coming to work, and you are still using that hand glove, what that simply means is that you are going to touch the surfaces within the company environment, and someone who doesn't have it will contact it from there. And for the fact that you feel you are wearing a hand glove at that point, you feel that there is no need to sanitize your hands. And that endangers others while you think yourself. So it's very important that we look at it critically. What are we expected to use? What is the nature of the job? What are the kind of people we are meeting? What is the distance that we stay with them? And we put all those things into consideration. That is the more reason company need to consult people who will be able to tell them exactly what to do and how to do it. Now, we have talked about those who are in essential duty. We are normally, we are expected to categorize them. At what point are you? You need to know. There is something my colleague said. She said that nobody can love her than her. All right. Now, what that simply means is that if you think that somebody will care about you more than you care about yourself, you might be joking. So, in other words, responsibility is the most important thing. You need to take responsibility, but then you need to understand the level you are operating as far as this pandemic is concerned, and to know how to protect yourself. We have the very high risk people, we have the medium exposure risk, and we also have the low exposure risk, okay, which is at the caution sign. Now, let's start with the low exposure risk. Now, workers who have minimal contact with the general public, okay, and other co-workers. Example, the office workers. Okay, you are just in your office and you are doing your work, maybe inside the office, but there are people at the reception, you are not part of them. So you are inside the office, you are doing your job, you are at the low risk. However, if the person at the reception should have this, believe you me, there could be a possibility of you getting it irrespective of where you are. Then we look at the medium people who are exposed somehow. Okay, now we said that these people are workers with high frequency interaction with the general public, like what you are doing, those working in schools, those working in restaurants, those who are in a retail establishment, those who are in transport. Okay, sometimes the way we collect money, even in a transport, a bus, in a taxi, sometimes you find out that if you are not careful, that could be a mode of transmission. Okay, these people are at a medium risk, but we also have the higher people who are the health workers, and of course, those who are taking care of those affected by the pandemic. Now, how do we prevent it? What must we do? Now, social distance is one of the things that has been recommended An example includes introducing a working shift. Okay, these people work today, the other people work the other day. Okay, by reducing the number of people in the office, using phone calls and virtual meetings. What we are doing, we are using phone calls, and thank God for this technology. They have been there for years. For those of us who are in the training environment that does online training, we have been using it for years. It has been working, but the pandemic has actually tell people or make it obvious to some people that they can actually host meetings. Okay, I remember first time when MTN came up with all this the internet that allows you to do meetings like that. It has been there. This technology has been there. But at this point in time, this pandemic need to expose people to the new normal. Okay. Number two is the hygiene. Of course, providing hand disinfectants, both at home, both in the office, both in your car, and wherever you find yourself. Promoting good respiratory hygiene at workplace. Very important. Number three is cleaning. Of course, it's part of hygiene, but regularly cleaning and disinfecting the surfaces of your desks, your handrails, okay, your door knobs, and some other surfaces, your computer system, some other surfaces you touch from time to time. And it is worthy of note that in this situation, people sharing computers might not be advisable. Now, number four is training and communication. Yes. I remember for those of you who find yourself in a construction or oil and gas environment, you find out that we don't play with a two-boss meeting. Every single morning, you come together, you talk to people, keep on saying it, keep on talking to them, keep on giving them awareness. Over time, it will come into their subconscious mind, and they will always listen, and they will understand that they have to protect themselves. And it is very important that you know that even the company cannot protect you the more you can protect yourself. It is your responsibility to protect yourself. And it's also a responsibility of the management to provide what you need to protect yourself. Just like our moderator rightly pointed out, that a company has safety wears, but they are using the helmet to eat them up. It's funny, but it's the truth. It's funny. We have regulatory agencies that goes to companies to look at what people are doing. But unfortunately, sometimes you find out that some of these regulatory agencies will inform a company that they are coming for inspection. And of course, a right person thinking with a right mind will always prepare his house because he's having a visitor. Okay. So now, can you go to this company and see what they are doing uninvited so that you see how to audit them? Okay. Tell them what they are doing right and what they are doing wrong. I think is going to help. Number four or number five is the personal protective equipment. And of course, the last one, which is response. Who are those people who can respond in case of emergency? Okay. And what are they expected to do? Now, this pandemic issue is not only directed to those working in a corporate environment. No. It has a way of affecting informal workers. What should they do? Somebody who is pushing a wheelbarrow, what should he do? Someone who is selling pure water on the street, what should he do? You know, you go to outside, you buy pure water, some people sachet water, bottled water. These are some things we see around. How do they protect themselves? Many need workers despite restriction on the movement and social interaction. Okay, these informal workers may be needed, and they are doing their job. The informal workers also may not be able to comply with this occupational safety and health. Okay? Now, let me shock you. If this program was to be a program that has to talk about come and invest a chicken and you will get a cow in 2 hours, my dear, the system you have here, the premium you bought to host this program will not be enough. It will crash here. I'm telling you. But when we talk about safety, everybody say, I don't care. Then who cares? And one very funny thing about safety in this case is that if you have 1,000 persons in a hall and everybody is a safety officer, and there is just one person who does not know anything about safety, I will assure you that one thing that this person who knows nothing about safety will do will endanger the life of 1,000 safety officers. What that means is that, like my colleague says, you cannot be safe when your neighbor is not safe? It's impossible. It is. So you have to be safe and your neighbor has to be safe. So how do we create this awareness in such a way that everybody will come to terms and understand the importance of this safety? As a safety consultant, we have always tried as much as possible to even go to the grassroots. We go to companies, we go to students in universities, we go to NYCs, we train pupils, different kind of programs to ensure that we inculcate this spirit of safety in them. Because sometimes they end up taking a larger number of people. Now, lack of insufficient protection. Some of them, they don't wear this mask, for instance, or they don't use sanitizer, not because they don't want to. I was in a car one day, and immediately I boarded the car. I entered and I put on my seatbelt. Okay? It was the driver that was telling me, after we have traveled a long distance, he said that, because I asked him, put on your seatbelt. The man, sorry to say that, the man was average, and unfortunately, it was more like night, and if he puts on the safety belt, he might not be able to see far. Okay? So when I was like, put on this, I said it during the day, and I was saying it close to the night, put on your safety belt. He was like, that he cannot see well, that I'm even trying. Why should I be, that him cannot be able to put it? And I begin to wonder, a driver is supposed to be the first person to tell a passenger to put on a safety belt. But now, the driver does not understand why he should. The problem we have in this country somehow, as far as safety is concerned, is that sometimes a typical African person or a Nigerian person, if he doesn't know why he's doing something, he will not do it. It's as simple as that. So if you are able to create an awareness and these people understand that this is the reason why they are doing it, most of them will tend to gravitate towards obeying what you are saying. Now, just addressing the risk, the stress, the psychological violence and harassment. These are some of the things that comes within this period. Of course, stress is one of the safety things that people need to understand. Stress comes in different ways. Do you know that you are trying to connect to this program and your video is not showing or your internet is not working well? It will have a way of bringing stress. Your immune system will start working differently because you are looking at time. It's almost time. I need to do this. I need to do that. And it's not working. Okay. It comes with a stress. So what are the common stress when there is a pandemic or right now we are in pandemic? One is fear for one's own health and well-being, for him and that of his family members. Lack of safety equipment for personal protection. When you are working in an environment and they are not providing you with what you need to do your job, company will say there is no money to buy this, and you on your own, if company say there is no money to buy hand sanitizer, can't you buy it? If anything should happen, don't be surprised, you will be affected greatly than the company. So in a situation where the company own has finished, my dear, I would advise, buy your own and put it in your pocket. Now, isolation. Of course, there are people who cannot even, some of us right here, there are people who cannot stay at home without going to work. And you find yourself in a situation where you lock yourself in a room and you are working from there, you lock yourself in a room. In fact, some people will sleep and wake up. I remember how difficult it was for some people who cannot digitalize their business during the pandemic. But those who understand that they can even work from anywhere, all this teleworking, that was even their best time to work. You understand? So lack of social support from families and friends, even those who have it. Encouragement. Okay? Tension between established safety protocols and the desire to care for support individuals. Okay? Difficulty in maintaining self-care, like exercises, okay, good eating habits. Some, like our own kind of lockdown was actually overnight lockdown. Okay? You wake up at night in the evening and there was an announcement that from so and so time tomorrow, there will be a lockdown. Some people doesn't have money. Some people have money, but they don't have time to go to the market to buy something. Some people are not even allowed to come to the market and sell. So you find out that there are people that doesn't have food stuff in their house. It's a very serious stress. You think of what to eat and what the family will eat. You think of the fact that you don't have money. So how can you be thinking of exercise when you have not eaten? Very sad indeed. Now, what are the common response to some of these psychological factors? Some of them include stress. Stress. Some of them include low mood, as in you be like, you are not excited, you are not happy because you are not meeting your friends, you are not talking to them. Low motivation. Even some people who are teleworking, working from home, you will not be motivated. Let's be sincere to ourselves. You are working for a company and you are working from home and your child is somewhere crying or going to a place where it's going to be hot. My dear, you leave your work and take care of your children. Okay? So sometimes if there is no motivation in terms of financial or encouragement from the top management, you find out you'll be like, every other person is resting. Why are these people disturbing me? That is why the company needs to provide motivation for these people who are working within this time frame. Also, anxiety and depression. These are things that set in. And if you are not careful, it can also lead to mental health. I can imagine a scenario where during the pandemic or during the lockdown, somebody is ill. You are supposed to go to the hospital to check up. You are supposed to go and buy some a kind of drugs and all that. My dear, you will not even be comfortable to tell somebody that you are sick because you are afraid. Because the person will look at you as a carrier. You understand? So these are things that will put this person at a low point where he doesn't know what to do. Now, there is a major problem that pandemic will bring. And there is a major problem that we need to face. And one of them is job uncertainty, job insecurity. The truth remains that a large number of workers or entrepreneurs and self-employed persons are out of work. Entrepreneurs who stay for 3 months without business. This business, whether you like it or not, this pandemic, whether you like it or not, has a way of affecting every business, including the person selling sachet water on the street. If you don't see people passing, how will they buy? If people who are passing feel that that is not hygienic, how do they buy? So it has a way of affecting everybody, including those who are entrepreneurs, including those who are self-employed, even including the companies, because some of them are folding. Temporary closure of business, of course, imposed by the pandemic during confinement. Some businesses are completely folded. Some businesses are closed, like tourism, construction, entertainment, and all that. These are some of the industries that were closed because there's nothing they can do. Change in the work processes and arrangement. Of course, job uncertainty will change in a work processes. Now, what that simply means is that the work system or the new normal will not allow a large number of people to come to work. So what that means is that after the pandemic, as a company, you look at this critically. Some people who find themselves in a human resource environment, you will begin to review the responsibility of some of your staff. Coupled with the fact that there are not much money as a result of business kind of slowdown. You look at your income, we need to reduce number of workers. Who is it going to be? What is this person actually doing? If we can be able to do this, and this during this pandemic, when this person was not working, what that means is that if we have so and so number of workers, we can actually do well and save some cost. So the arrangement will change, the nature of job will change, and people will be out of work. Now, present and future uncertainty of work. Of course, it is very important that we note that it will increase stress. Why will it increase stress? Because a bigger load of work or job responsibility will be bestowed on one staff because some other people are not required or because the company cannot afford it. It will lead to stress. It will also lead to anxiety and depression, sometimes burnout. Reduce motivation from the worker. Some of them, they will begin to consider even resigning because the work is becoming too much for them. Okay? And higher work-related injuries. Okay? It will come and people will suffer it. So now, these physical factors are things that we need to look at, and we ask ourselves, workers in the emergency response in essential services, what should we do for them? It's very important that we have a good communication, like we said before, checklist of assessing personal strength and limitations, And also very important to regulate the rest period. This person must be able to rest well, exercise well. A role model like a supervisors and all that must ensure that he mitigate the stress. And also very important, there should be a campaign to reduce stigma. Now, stigma in this case, I remember how it was during the HIV, but these days you can be moving around with someone who has HIV and you will not even know that the person has HIV. The stigma is not the way it used to be because of awareness. Now, the kind of stigma on this pandemic is too strong that if you sneeze at the public, in fact, there's a way people will look at you. I saw a video during that time that was in China where somebody sneezed in a public and he was shot. Okay, by an officer around there. He was shot, live death at that point. So what are we trying to say? It is very important that we tell these people that has this thing that this is not the end of life. Okay, it is not the end of life. Now, talking about the new normal, where technology is going to take care of everything, where people are going to be working from home, what are the common psychological factors? It's good to say that people are going to be working from home, but then in our risk assessment, we need to also consider the factors surrounding people who are working at home, like inadequate information. Okay, I have been called several times by companies, maybe to submit proposals, to talk about business proposals and all that. And don't be surprised that when you ask a question, very simple question, the person will tell you, hold on, I will get back to you. What is he getting back to you for? The point is simple because he doesn't have the right information you are asking for. So he has to call his superior before he gets the right answer to respond to you. Sometimes you even be listening to the underground conversation because this person is not the person handling it before. Now you have given the responsibility to a different person. So what you do is that when this person calls, you'll be hearing underground conversation, asking the next colleague, what is this? What is this? Information. And sometimes it might lead to low turnout. Isolation. You lock up yourself in a house, in a room, and you are doing what you think you should do. Long working hour. Of course, during this pandemic, in fact, I'm a victim. During the lockdown, I discovered that every time is work. From morning down to night, because you are in your office, in your house, and you are doing your job. So you might not even, it's very rare for you to differentiate when you have come back from work and when you are working. You work day and night. So longer hour of work, blurring lines, okay? Blurring lines between work and family. Yeah. You have families, you have work. And naturally, your interest should be sometimes people, as a worker, working for someone, you find out that your interest is more of the work than the family, whether you like it or not. Because there is unemployment and there is something you will do and you'll be affected by a sack. Okay, you need to do your best. Whenever your boss calls you and all that, you need to respond immediately. So with that, you find out that you respond more to work than your family, since you are working both day and night. Multiple burdens, like working duty, you have a house chores, you have caretakers, you have a homeschooling. You have to teach your children, you have to, household chores, you cook and, all whatnot. And you are going to combine all these things with work at home. It becomes frustrating. Okay, you feel like I can't wait to leave this house and go to work. Sometimes it's also lead to domestic violence. That's the bitter truth. When you are too close to someone for a very period of time, it might lead to, you will not be appreciating yourself. Even in relationship. If you have not seen somebody for over a period of time, if you see the person, you'll be like, you hug the person, oh, it has been a long time. You exchange pleasantries and all that. But when you keep on seeing this person, it becomes a kind of, and the way you address the person, the way you talk to the person, the way you behave might change. It's a natural. Now, people working from home, okay, what should we do to them? Having looked at the risk, having looked at the factors that will affect them and the distress coming out of it, what should we do to them as a company, as a management? One is management commitment and support and connection with supervisors and colleagues. Management commitment. It could come in form of checking up on them. It could come in form of, just imagine that somebody is working from home and you are not providing data for the person. Just imagine that somebody is working from home and you are not providing airtime for the person to have conversation. Is it the person who is looking for food that will go and buy airtime and put on company's line? No, it will work. Clear expectation. You need to have an expectation. This is what we want from you. This is your task. This is your what we are expecting to get from you. Leave some other jobs or responsibility that are not necessary. Focus on things that are important. Flexibility. Also, disconnection from work at specific time. Reserved for rest. You call the person during the day. You call the person during the night. You call 24 hours. It's good. But my dear, you need to understand that these people are human beings and they need to take care of themselves. If they die today, your company will continue. That's the truth. Now, appropriate equipment for doing their job, like computers, like laptop, like applications, IT supports. Like my colleague rightly said that at the comfort of his house, somebody stay somewhere and work on his system. Yes. The truth is that some of these technologies has been there. But how many people are using it? Now, many people are automating their system now. And when you automate your system as a company, it will drastically reduce the number of staff you have. It's as simple as that. It saves a lot of costs and it makes you more efficient. Okay? So now, embracing technology is going to help provide them with the requisite information, provide them with the equipment that they need to do their job. And of course, training is also very important. Good system of communication, support services from time to time, including employee assistance program. These are very important as well. As I round up, please, it is very important that ergonomies should be considered. You know, sometimes the company be like, you work from home. When you tell this person to work from home, have you ever think of what is his home like? What is the environment like? Can he be able to stay where he is and make an official conversation without interference from the neighborhood? Okay? Does he even have a table in his house? There are some stuff like that. You need to understand that. So, assuming this person doesn't have a table where he can sit at home and work for you, that means he's going to sit down on his bed with his laptop on his lap. And he's working. Ergonomy has set in. The position or posture you are forced to stay while doing your job, it has a way of affecting this person's health over time. Awkward posture associated with a long working time, high workload, and pressures. This thing will lead to musculoskeletal injuries, like the spinal cord, okay, waist pains, blood issues, and all that. Diminished work capacity. When you are not sitting properly in the right position, my dear, you cannot be productive. It's as simple as that. Reduce ability to adhere to strict work practices. Increase absenteeism because you are not working. Naturally, you need to understand, I'm a kind of a human resource consultant, and over the years, I've been able to understand that a greater percentage of workers are doing what we call eye service. They work when you are seeing them. They tend to be more efficient when you are there. Now, if it is happening within a company, when the boss comes in, you see people, everybody tends to, rush up and down to do one or two things. What do you think is happening when you are not there looking at them at home? So they can be working, but they are not working. High risk of workplace accident. Of course, this place is doing the job in the place where he's not supposed to do it. And it will lead to accident. It is also very important that we look at, we have made mention of PPE here. In risk assessment, we look at things holistically. We look at it critically. Okay? It's good. We have said provide the personal protective equipment, but also there are some risks associated with it. How do we use it the right way? Okay? Healthcare workers may also face risk arising from the prolonged use of heavy PPE, like heat stress and dehydration. Okay? Heat stress and dehydration, dizziness, and physical marking on the face or on the body where you are wearing it. Those who are also working in an environment where they are using the chemicals must also be very careful because all workers must be properly trained on the correct and safe use of chemicals. Okay, exposure, what they should do and how they should do it. And of course, as I round up, people working from home should also understand the following. They must look at the environment they found themselves. They must think of the right facilities. They must look at the physical environment, such as heat, such as cold, lightning. What amount of light is required for you to work within this environment? Electrical safety, and of course, home hygiene. Workers should receive adequate information also on reviewing where the screen is located to avoid glare. Okay? How is the system supposed to be close to you? What kind of brightness are you expecting? How best to place equipment to minimize twisting or overreaching? Your position. You need to understand. They need to be trained before you tell them to work from home. Varying work tasks to change position. How do you change? Like you are working in an environment, from time to time, you need to come outside and look at the natural environment because it helps your vision. Okay, you see the daylight, because if you are in your office, you are seeing light, no doubt, but then you need to see the daylight. It helps to reset your retina the way it's supposed to be. Taking regular break from time to time, you stand up, you move around, you come back. Okay, I have been in an environment where I have to tell, you know, you look at the office setting, you find out that almost everything you need to do your work is on your desk. And if you find yourself in such environment, you find out that you might sit down from morning till the end of work without moving. That is why in office arrangements, sometimes you need to consider the fact that, oh, I have a printer, let me take it a little bit far. I have a phone, a desk phone, let me take it a little bit far. Okay, so that when I am working, if there is a call, I can stand up from where I am and go there and pick my call and come back and sit down. Oh, I want to print something, I send it to print, I go to the point where my printer is and I pick it up. While you are doing that, you are moving, you are changing position. Not like sitting down like a dummy from morning till night. It will not really help. How best to place your equipment, very important. Positions, and of course, taking regular break, we have talked about that. And finally, before I leave you, it is very important that we look at the key pillars, the things that must be done in time of crisis, COVID-19 per se. One is stimulating the economy and employment. We are in an environment where some entrepreneurs are not supported to thrive. And pandemic has come to cripple so many of them who doesn't have a business continuity plans, just like my colleague said. And some of these entrepreneurs doesn't even know what is insurance. Their business has not gotten to a point where they should be talking about insurance. That is what they feel anyway. So now, how do we stimulate these people? How do we make them to come back to life? How do we, now, you need to have a fiscal policy that accommodate monetary policy, lending financial support. Online yesterday, somebody sent me a WhatsApp message talking about youth empowerment funds and all that. You know, sometimes we hear this thing online. Sometimes you don't know whether they give to people or not. Sometimes you don't understand the conditions attached to it. Very stringent in such a way that most people cannot even access it. Okay? They give you conditions, loan, you know, you are taking loan and what you require to bring, collaterals and all that. And some of these startups doesn't have all this. Okay? Now, it is very important that government look at that. Then too, supporting enterprises, jobs and income is very important to support these people by extending social protection for all, implementing employment retention measures. Now, do you think that if government is providing a palliative to companies to pay workers' salaries, do you think that these workers will be relieved? No, they will not be sacked. But when the company look at it that, oh, we can no longer be able to, they will downsize. It's normal. They will downsize. But if government is giving them support, don't leave these people to the street, allow them to be working with you, but we are going to assist you in paying their salary. I can assure you that these workers will not be removed. Job security will be there. Protecting workers in the workplace. Very important that you look at all what we have talked about, like teleworking, like shifting, like preventing discrimination and exclusion, providing healthcare access. Okay, so many companies today doesn't have what is it called? Health insurance, HMO. Okay, so sometimes you find out that the only time that some companies have a social insurance trust fund is because they are using that document to probably secure one contract or whatever. Otherwise, most you go to many companies, you find out that they don't have it. What are the benefits of these workers? In a situation where something happens, what do they stand to gain? Okay, relying on social dialogue, very important that we always look at things from other side critically, and everybody come up with a suggestion of what can be done and how it can be done. And also very important that we promote safety at all time. Everybody must take responsibility. And on the social dialogue, we need to understand that employers must collaborate with the government to shape policies. Very important. It is also very important that employers observe and advise guidance provided by public authorities, like the NCDC. Okay, it's also very important that on that dialogue issue, that we will communicate critically, or we communicate critical information regarding to the safety of workers to them. It was so important that we review and draw a business continuity plan, okay, to ensure that this business will continue. Identify and mitigate risk and contagion to workers. What are the risks? Who are these people who are prone to risk? What can we do for them to ensure that they are not too much exposed? And also to promote workplace hygiene. But on the worker side, as far as the dialogue is concerned, the workers need to participate in decision making. You cannot bob my head without my presence. I need to be there for you to bob my head. Is that not correct? So what that simply means is that these people need to be included in this discussion. They should be part of the policy making as far as epidemic or pandemic is concerned. Actively cooperate with employers in implementation of the preventive and protective measures. The management cannot be there to watch you. For instance, the management has done, in the instances you gave, the management has done what they can do by providing personal protective equipment, by providing training for the staff. But then it's up to the staff to ensure that they are doing everything possible to implement these guidelines and protective measures. And also strictly follow the workplace hygiene and every other thing that is required to be done. Now, very important as I close, this will be the very last thing we need to look at. Of course, today we are safety professionals. And at certain point in time, we talk to people, we try to create this awareness, but more is required to be done. And let's start from us. In this program, I don't know how many we are, but I think we are between 15 and maximum 20. And let me shock you. The caliber of people here, most of them is either they are abreast of some of this information or they are not. Who is our target audience? We are organizing this kind of program. Who are we targeting? Who do we want to talk to? That is why when I was talking, I made mention of the informal workers. There are people who doesn't even have a phone, not to talk of being online. There are people, thousands of people that will tell you that they don't even know what Zoom is, not to talk of joining Zoom. A program of this nature can be streamed live on Facebook or whatever, so that people understand, people listen, those who feel that they want to hear. Okay, so we need to facilitate, as professionals and practitioners, we need to facilitate access to reliable information. And part of the access to reliable information is making sure that this information we are disseminating here goes to the right people, the general public. Number two, promote understanding of the disease and its symptoms. Of course, what health organization, what safety organization, international labor organization, these people has played a major role by making sure that this information is provided to people. But we, in our own side, we need to continue disseminating that information. Three, support in the risk assessment and management processes of identifying as professionals, identification of the infectious person and non-infectious person, what are the infectious hazard and non-infectious hazard, what are the assessment of the risk, what are the adaptation, what are the prevention and the control measures, how do we monitor? These are some of the key areas that we need to factor in. And also, we need to help in the development or update of plans for the prevention, containment, and the mitigation, as well as recovery of this pandemic and every other pandemic which we have been able to contain in the past. And looking at the tremendous success that Nigeria was able to get during the Ebola time, we believe that this pandemic can be contained, can be managed, can be controlled. Okay? But then we cannot do it without everybody's support. Everybody is a stakeholder in this, and we must put our hands together to ensure that we get this solved. Okay, so and without taking much time, I will be stopping here because I was given a very short time, and I don't know if I've taken more than that, but sorry about that. It is the passion we have for this and how we can come together to ensure that we are able to solve this problem together. Thank you very much for your audience, and I'll be open to receive any questions if there is any. Thank you, our
Thank
coordinator.
you so much. Thank you so much, Mr. Max Uneke Friday,
Thank
for
you.
this insightful presentation on the pandemic, safety and health at work to save lives, and also how to prepare for return to work under a risk control scenario. He's giving us a very lengthy lecture on this, and I hope and believe that employees and employers here will go back to their workplace and implement some of these things. If they are not available, please, we must try to do so that we have a safe workplace to work in. One thing he said that particularly touched me is the fact that employees should be able to know the type of work they do. If you know the kind of work you do, it will help you to know the type of safety measures you will take, or employers also will know the type of safety measures they will put in place for the employees. He's spoken so much, and I'm not going to flog that. One thing I want to say is when he was asking our audience, we know our audience already, and he was talking about those who do not have access to such platforms like the Zoom and all that. We have a YouTube channel, and all our conversations are found on our YouTube channel. When this program is edited, it will be sent to your email. So you just go to the YouTube channel and watch. And then we also broadcast it to different social media platforms. So it's not just those who have access to Zoom that watch it. People sit down some other time and listen to this conversation. We make that available to everyone that can maybe that has at least a phone to watch on YouTube and all that. And for those who also work in the offices, they can also watch from their offices on their laptops. So it's made available. Thank you so much, Mr. Uneke, for this for your presentation. And before Fire Williams left, she left a link for a free ebook titled The Entrepreneur's Checklist. I have put it on the chat there, so you can look at it and go to that blog. There's so much that you can get from that. It's free. You can go there. It's a http the whatever to the bitly preparebusiness.com. When you go there, you will see it. Just click on that. You will see. You go to take you to the blog. You take you to where you can read whatever she has there, and it's free. Thank you so much. I want to thank all our speakers. I want to say that safety at the workplace is more important than the value of the work that you are carrying out.
Exactly.
I just hope we take this, that your safety is more important than the work you're doing. If you have this at the back of your mind, you will always be conscious of your environment and the safety of that environment. Unsafe practices may turn out into loss or damage to the management. You know, some of our employers, they'll say, there's no money for this, there's no money for that, there's no money to provide for this. But it will turn out to be a loss and damage. And it will also make the worker sick or unhealthy. So who does the work? Neglecting the safety and health at the workplace may increase the expenditure and reduce profitability to the management, besides chances of losing manpower. So it's very important that our environment is safe to work in. Our environment is provided with all the safety materials we need, your staff or employees need to work. Once again, I want to say thank you. I don't know if my CEO has anything to say, or if there's anyone that has a question or a contribution to make before we close this curtain of this program. Okay, I have the Safety Wear House Limited Company, Prince eBay, is raising his hand up. Thank you so much.
Thank you very much. Sorry, I came late a little bit because the traffic was so much where I'm coming from.
Yeah.
Okay. So what I'm trying to say is I enjoy the whole discussion and the topic. What I'm trying to say is that for us to move forward, we need to get safety outside labor, because labor is withholding us back seriously in this country. Because if you look at Lagos State Safety Commission, they are doing some perfect job in Lagos here, while in the other part of the country, nothing. So if we can be independent from labor, that would be great. Because in other part of the world, you have they are independent. So they make their own laws. They go out there, like Mr. Is it Francis Friday
Friday,
said,
yes.
yes. When you go to before they go for inspection, they need to inform the people. That shouldn't be done. It should be a way that you go there, you don't inform anybody, and that's how you can change things. But immediately you inform them, you get there, you will not see nothing, because basically here, the safety aspect of a thing they know here mostly is to do with a helmet and coveralls and all this stuff. We have more than that on safety. When you come to safety, there's more than that. Because when you go to training some places, you find out, or you go to risk assessment, you find out nothing. There's a website I wanted to create where we can set it up. It will be free for the workers to lay complaint, just like what channels have. I have something to click. You send your information, whatever is happening in your company, there, whatever thing you can snap those and send to us and put informations, so that this group of we can go to those places and find that and have a proper law that guides. But there's no law in safety. That's why most of this company they don't buy anything about safety, because if you look at the art, if somebody fell down or died at a working place, the cost means nothing. So I'd rather pay 50,000 naira than spend money training staffs. So there's a lot to do. Okay, like the other day I was discussing with the road safety people. Doing these roads, do you sit down with them? So just like I was discussing with the road safety people, these road constructions, are you involved in this road construction? Because you only go out there to oblige cases of safety, but you don't even have road signs. You don't even have nothing to say you're supposed to be doing 30 a mile here or 40 here or 50. You don't have it in the highway where there's slope, where you can driver indication earlier enough. Sometimes if you go to Lagos here, you see traffic system, safety sign there. You will, when you're driving towards Silverbird, They will tell you when when the safety light turn red, turn right, whether you like it or not. And there's no sign indicating that. This sign will be right in front of you there. You start fighting with the same man, what's it called, this legation traffic wardens, last month. In this international, nothing like that there. So they're supposed to create a way so for people to turn right without the traffic light. They have something like that again somewhere. I've written to them, but nothing is being done to do the safety problems we have in this country. And if you understand the safety culture in this country, there's two sides of the safety. If you go to the north, nothing happened there. Because 10 people sit behind the Gulf and travel from Kano to Kaduna. So by the time we get from the Ministry of War, become independent, we can come up with our own suggestions and laws to the National Assembly. They can pass the law for us to work with. Because whatever you want to do, you need to go to the labor, and labor has the say for you. So as soon as we go out from labor, I think we're going to work, and we're going to create a lot of jobs. Because by the time we put these policies, by right, any place you have more than 20 staffs, there must be HSC worker there. And this HSC worker, imagine if we have 10,000 companies in this country, we are going to, places like banks, we have centers where these HSC people will come and train. They get certificates across the country. So if we have 10,000 companies, which we need to have safety workers 24 hours there, we create a lot of jobs in that area. The same way, the people that are selling the products, they will be selling. There will be business all over. But in this aspect, all they know here is just the helmets, the boots, and the coverall. I have some products in my warehouse here that I brought from the UK when I came back from the UK. Most of them are, if you take it somewhere, they don't even understand what they need it for. In fact, I sold most of those chemical suits during this COVID because I have them here for long. When you go to those companies, you ask them, you need chemical suit for chemical job. They will say, I've been doing it for years. So we need, like you said, we need a lot of awareness. So even I'm trying to do those products in the sense buy one you get one free in that aspect, so that people will know how to use those products. We have a lot of thousands of products that they don't know. They only know safety shoes and safety wears and helmet. Thank you very much for that. Huh?
Thank you very much.
Hello? Okay.
Yeah, we can hear you. Yes.
Okay. Thank you very much.
Thank you so much, Prince Ibe, for this insight. We should take labor away from this. In so doing, I think it will be more effective. Of course, I agree with you. When you tell a company you are coming for inspection, they will put even if they need to go and hire and borrow and put these things in place, they will do that just for that purpose. And afterwards, well, it becomes it goes back to business as usual. Thank you so much, Mr. Prince Ibe. I just want to ask Leaking Salt, please, can you come up and ask your question or make your comment?
Good afternoon, everybody.
Okay, you're welcome. Good afternoon.
Okay, I have something to add, and the other ones are questions.
Okay.
The other ones are questions.
Okay.
The first one,
Okay.
what I need to add is reporting. You need to report it is advisable to report every safety incident. As little as falling off, you missed your steps, you understand, on the staircase. Even as little as maybe you cut your hand, a finger, with a razor. So I think reporting too, this time. Then the questions I have, the first one, the first speaker talked about minimizing risk. Now, as far as HSC is concerned, is the primary motive to minimize risk or to prevent it from happening? Then, number two, The first speaker also talked about concept and decommission, from concept to decommissioning. I don't know if she can shed more light on that. I mean, as it relates to HSC. And the last one, I think she's gone now, Mrs. Fire Williams. She said something like mouth-to-mouth resuscitation. Is no longer, they don't use mouth-to-mouth resuscitation again, sorry. So what has come to replace the mouth-to-mouth resuscitation? I hope you heard me. Sorry, I have a bit of
Yes. Okay. Prince Receiver, please. Can take up the questions. I'm going to unmute you now. Okay, please unmute yourself. Okay.
Okay. You have the ADC, ADE. It's automatic system that you just place on the person. Instead of going contact mat to mat, you just put it on the person's heart, and then that will give you this thing. And then we'll have another one, what we call, if you want, I can just grab it. We'll call it, it's oxygen as well, mobile oxygen, which you can just put to the person and then get the person back. But you have this ADC kind of machine that you use. So you find it more of in oil companies, most of them have it. But that's the same thing the ambulance people carry along. So you can use that. You must not go mat to mat any longer.
Okay, thank you so much. There are machines now we can use instead of mouth to mouth. And when you press it, you
Yes.
Press a button and then it supplies oxygen.
Oxygen.
Yes, it
And
does.
then we'll have what we call life to, what's it called again? I'll get the name. I'll come back to you.
Okay. Thank you so much.
Okay.
The question she asked about minimizing risk or preventing risk. I don't know if can Mr. Max, can you say something about that? Mr. Max Uneke? Okay. Okay, Prince, you are still talking. Okay. Okay, go ahead.
Can you hear me now?
Yeah, go ahead.
Well, when it comes to safety, our primary concern is prevention. We want to do everything possible to prevent this accident from happening. But in a situation where we cannot be able to do that, we reduce it to as low as reasonably practicable, which is what we have an acronym ALAP, ALARP. Okay. Our major aim is to prevent it, even from near miss. We don't want it to happen at all. But in a situation, we have used engineering procedure, we have used prevention procedure, we have used all the kind of procedures that we can, including PPE, which is the last line of defense, and it didn't work. Then we should reduce it to as low as reasonably practicable. Assuming you are putting on your helmet and maybe block is maybe in a construction site, and block is falling from a two-story building and it's supposed to hit you on your head. If you are not wearing helmet, there's possibility that the block would have actually break your head and you die on the spot. But because you are wearing helmet, the block will hit on the helmet. Maybe your neck will shift a little bit, and before you know, they will rush you and treat you, and you become well. So it has mitigated the impact, but the primary aim is to prevent. But if we cannot, we reduce to as low as reasonably practical.
Okay.
Thank you.
Thank you so much. Principal, you were raising your hand up.
He has taken the question already.
Okay.
So that's fine now.
Okay. Thank you so much. Mr. Kenneth, do you have anything to say?
To that, let me say something to that. Okay. Another thing is to wear the right PPE, because here they just put on PPE, the same PPE, because they go out there, somebody bought it for 10 naira. They want to buy the same PPE for 10 naira. They don't know there's different PPE for different chemicals, different PPE for construction company, different PPE for mechanics. So there's thousands of PPE. Even though the fisherman has the kind of PPE they wear. the people in the kitchen has their type of PPE they wear. So these are things they need to understand when you come to that prevention as well. Thank you.
Okay, thank you so much. I was asking my CEO if he has something to say, so that.
No, I think I'm fine. I'm fine. I think I've been enlightened,
Okay.
and a lot has been said. I wish Ms. Antonia Berry could come back to wrap up, because she mentioned the absenteeism of so many of the things or safety devices in this country. And Nsibe has also come to say that we don't know the specific PPE for specific purposes.
Yeah.
And we need to understand that.
Mm.
So these are conversations that must be taken to several organizations, different of, what you use in a tomato paste manufacturing plant is different from what you do at a plantation palm oil plant. So these are things, because they have different, chemicals. So I think those are the things that this consultant and the professionals need to be able to bring to the fore in terms of how people do, the application of so many of these PPEs.
Okay, thank you so much, sir. I don't know if Mr. Friday has any last thing to say to us before we close.
Thank you very much once again. Of course, there will always be something to say as far as safety is concerned. One of the things I will say is that just like we are talking about, sorry, I've been battling with my video and all that. I think I've been able to come live now. Okay, some of the things we have been looking at is training. Training as far as safety is concerned cannot be overemphasized. I will also say training and retraining, because it's when you are trained that you now know that, oh, this is PPE and this is what it's supposed to be used for. This is PPE and this is the type of thing it prevents. I'm supposed to use this kind of PPE when I'm doing this. This one prevents this from happening, so I should use it. Now, this is the kind of fire extinguishers I need to fight a kind of fire. But generally, sometimes I have been to a company that I was supposed to train, only to find out that something happened. That they have safety officers, no doubt. They have what is it called? Fire extinguishers. But I was surprised to find out this one actually happened. That was a military base. I was supposed to train a division. I wouldn't want to mention the name. So when I got there, after inspection, I discovered that some of their fire extinguishers are under a shed, well positioned in the right place. I believe a risk assessment was made to put them there. But funny enough, some of those fire extinguishers, you will notice that the last time it was serviced is maybe 2012, and you are in 2020. Some of them, the label is no longer there. You can't even know whether it is functional or not. And these people don't understand that this fire extinguisher, it works with a pressure. Now, if you allow these things to stay over time, there's possibility that the air inside can actually evaporate. Once it goes out, you find out that the only thing inside is powder. If it's CO2 also, the same thing. So you find out that you are supposed to be servicing these things. If you have a smoke detector, from time to time, you are supposed to do a fire drills, okay, to ensure that, oh, this smoke detector is actually working. So that in an event of fire, you'll be sure that this thing can actually trigger. So these are some of the things that we need to, I will boil it down to training and retraining, communication, dissemination of information. We need to ensure that people are informed, and not just informed ones, but all the time. Because one thing I've seen over the years is that when you are preoccupied by a particular thought, a particular information, over time, you will tend to behave that way. But if you just, they just come once in a while, I ask somebody how often do they train? Some of them will tell you they train quarterly. Some will tell you they train 3 times a year. Some tell you they train once. There are also companies that doesn't train at all. Some information you have today can be obsolete tomorrow. So how do you put yourself up? How do you ensure
I
that
think
you are
network
doing the
has
best you can do to ensure? You need to ensure that what you are doing is up to date. For some people who doesn't understand that mouth of mouth is no longer work, at least if not for any other thing, the pandemic will tell us that you should, since you don't come close to somebody, you need to be thinking of how else can I, do this same thing to ensure that this person is safe without mouth to mouth this thing. So now, if you have been thinking that that is the only way you can resuscitate, then you need to find out that maybe after the pandemic or after a series of analysis and all that, people now discover that, oh, this one is no longer safe. This is now the new thing. If you find yourself doing the same thing, you are in trouble. So we need to understand that, because that is the only thing that will help us to understand that, oh, we need to wear our PPE. We need to wear this kind of PPE. We need to wear it and wear it correctly. We need to do this at this time. There are people, you go to their working station, some of them will, when you see the work environment, as a safety personnel, you will find out that in an office where two or more persons are sitting, as a safety professional, and you are doing your risk assessment, you will see more than 20 risk hazards waiting to happen. So, and when you are seeing this thing, this person is not seeing that because it's not trained on risk assessment. Somebody can just come and see wire, but this person is not seeing that this wire is capable of causing trip and fall. Somebody is seeing a material. He doesn't know that this thing can actually cause fire. Somebody is seeing something that is positioned on top of a table or on top of a cabinet and all that, but he's not seeing the possibility that this thing can fall from up downwards. You understand? There is a time that they gave us ESPON, or part of the safety rules anyway. Let's not talk about people. Part of safety rules anyway says that you should not work under suspended loads. Now, there are some offices you enter, you see a managing director of a company with 1.5 horsepower AC over his head. He thinks he's enjoying his life and he's okay. But then you need to understand that you can still position that thing in another way and you still feel the air. By right, you are not supposed to be having those things under you. That thing can fall. I've seen a picture where somebody has a shelf around him. And unfortunately, the next morning before he came to work, he has books and all that there. Before coming to work in the next morning, he found out that the shelves pulled out from the wall and fell on top of the seat. So the question is, assuming this man was sitting on that particular seat when the thing happened, maybe he would have been a dead man. So there are certain things we do that we don't know that we are not supposed to. Everybody is a risk assessor. Even a layman in the village, even a layman walking the street. For instance, you want to cross the road, naturally, as a human being, you look by the two sides of the road. If you see a car coming, your brain, your common sense will tell you, oh, this is the car, this is the distance of this car, and this is the speed that this car is applying. Can I be able to cross this road before the car gets to me? If you can cross, then you go ahead. If you cannot, then you have to wait. Talking about states or cities where you don't have a kind of flyovers or pedestrian lane for people to pass. There are still places. Somebody was talking about designs. Now, design is a critical part of safety, and you cannot overemphasize it. I happen to come from a construction background, and whenever we design, in fact, criticism is one of the major things that is required in whether engineering or architecture. Sometimes an architect will design a particular thing considering certain factors. But when the person doing the actual construction comes, he will be like, why would this person put this? It's not necessary. But you didn't know what the person considered. There are basic things you must consider when you are talking about designs. One, the very first thing is functionality. What do I intend to achieve by doing this? Okay, I design project. What do you intend to achieve? What is the essence of having this road? What were the challenges we were having? Who wants to use this house that I'm building? What are the things he needs? Are we expecting a disabled person? Are we expecting those who, you consider a whole lot of factors. By the time you put all these things into consideration, then it will now form the brief you are using to design. Oh, what is the environmental factor there? How many times do we have sun? What is the position of the north, south, east, and west? When did the sun rise? These are factors that every qualified person must consider. By the time you put all these things into consideration, you now ask yourself the next thing: safety, which is the second thing. After functionality, the next factor you consider is safety. Oh, if there is a fire outbreak here, how do this person run out? If, in fact, some of you just check very well. If you look at your office now, where you are, you will notice that the distribution board, the electrical panel, is somewhere located close to the staircase. Now, if it is located close to a staircase, you are endangering people's lives. Because in event of fire outbreak, for instance, assuming it's electrical fire, it's expected that this person goes out through the staircase. And if fire is emanating from that place, what do you expect the person to do? It becomes completely difficult for the person to run out. Now, also, it's very important that when you find yourself in an office, you must have an exit. You know, people misunderstand exit, an emergency exit or fire exit and all that sometimes. The reason is because when you enter through the main door of a company or an office, and you enter there, maybe you see some signs within the office, exit this, that. It's good one. It's very important we have that. But the most important exit is, how do we leave this building? How do we evacuate? There are some buildings that you see, and the only way you have is just one way in and one way out. Whether they put exit inside the rooms and inside the offices and all that, at the end of the day, everybody is coming out from one particular place. Now, if all of us are coming out from one particular place, then what is the exit? If there should be a criminal or a bandit or armed robbery happening at the front of that entrance, what do? You stay there. You cannot go out. So these days, most companies, if we go there as an auditor, ISO 9000 as well as 45001, when we go to companies to audit them, there are certain things we look at. Okay? Now, if we find out that you are occupying a building that was not initially built for you, you know, one of the things we do in this country is conversion. You can build a house that is supposed to be an event hall, and all of a sudden, nobody is taking that. You give it to a church. Now, this colleague said, is now located within a residential environment. Every day they will put on their speakers and you get knocked. As if you don't like what they are doing. But how do you discomfort people? This is a residential area. And you are putting on your speakers, you are shouting, even at night. Night vigil, this, that, because there is a misuse of this facility. Now, even during the design, sometimes a building project was designed to be for maybe a residential building, and somebody is converting it to commercial. It's a problem. It's a safety issue, because the dead load and the life load on that particular project was designed to take care of, let's say, 10%. But now you are converting it to a church, and in that church, you have more than 50 persons in the church. And they are not just 50 persons sitting down quietly. They are jumping, they are dancing. Now, you find out that this thing can actually, sometimes, when they say building collapse, who investigates? How many of these investigations are published for people to understand that this is actually what happened to this project, why it collapsed? What can we do to ensure subsequent ones? So when you talk about designs, you need to look at that functionality first. Then you look at the next thing, which is safety. After looking at that, that is when you look at the third thing, which we call aesthetics. Oh, how do I want it to look? I want it to look beautiful. I want it to look like this. I want it to look at... You can design a house that looks like a plane, no problem. Oh, it looks beautiful. Everybody that is passing is looking at it. Fine. But then you need to consider the most important things, which is the function, what you are using it for, and also the safety aspect of it. What are the things that we needed to embed in this? For instance, if you don't tell somebody that the function of this building is a public environment, the person will not, the architect or the engineer might not consider the disabled. Sometimes when I listen to radio, TV stations, they will there's something I heard on NTA, was it yesterday or day before yesterday, where a woman who is, I say deaf or dumb, I don't know which one. She was saying something that she will be the first to go to the hospital and be the last to come back, because she found it difficult communicating to those who are working there. Now, the problem is this. You are creating a public environment. Now, a disabled person are not just those who cannot walk, who are in a wheelchair. These people who cannot talk, who cannot see, are somehow disabled. What provisions do you make for them? Okay? So when they come, they have someone, that is why they are talking about sign languages. What provision do you make to ensure that these people has a way of listening to what others are saying? Or you go to a hospital as someone who cannot talk or hear, how do you communicate to a doctor? You understand? These are factors that must be considered. But then sometimes it comes from the client brief and you work with that. All of a sudden, he will come and change what he wants to use it for. He's converting it to something else. So the first design has been designed and it has been approved. That is why somebody asked a question on commissioning and conceptualization. So you find out that at the beginning, we have in projects, there are stages. Please permit me to quickly answer the lady's question. Okay, since our speaker is not there. Now, in project, there are stages. Okay, the pre-design stage, the design stage, and the post-design stage. Now, at the pre-design stage, this is where you begin to call all the stakeholders who are part of this project to come together. This is what we want to do. How do we do it? And these stakeholders could be, if it's a building project, or let's say it's a hospital, the architect might not be a doctor. He doesn't know the spaces you needed. There are standard spaces, but what you need is quite different from what the standard says. So there is need for you to tell him, oh, I need this, I want to have this, I want it to be as big as this, I want this one to happen. Then all the stakeholders, both the safety people, both the engineers, both the quantity surveyors who are looking at the cost, everybody must be there. We look at it. Oh, we want to look at, we want to use an aluminium roof on this. What is the cost implication of this? The quantity surveyor will be in a better position to tell you that using this thing will cost you so, and so. Besides, you have already predetermined your budget. So they look at all these things from the beginning. So when they have looked at it, they come up with a design, a concept first. In that concept, they still criticize it. Oh, this one will do this, this one will do this. If we have this one will be like this. Everybody contributes. You understand? At the end of the day, they come up to a design stage where they start working on the designing the working drawing. But where we have issues is a situation where you contract a company, and let's say
Hello,
the road
Ahmed.
is going to be in Port Harcourt. Okay, let's say the road is going to be in Port Harcourt, and the contractor is Julius Beja somewhere in Lagos. Now, imagine a situation where they don't send delegate to come to Port Harcourt to see the terrain, to see the land level, the landmark, the water flow, and everything. And they just stay there and design a road that they will come and construct here. How do you think it will work? They have to come. But coming is one thing. Because when they come, they look at so many factors. Remember, these people have never used this road before. They have not been here. They don't understand what happens here on Mondays. They don't understand what happens on Wednesdays. They don't understand what happens on Saturdays. So they just come to look at the terrain. Now, that is the more reason why the stakeholders who are using it should be considered. Some of these people who are using this road should come out and say, oh, these are some of the challenges. During the rainy season, these are what we pass through. At this particular spot, this is what happened and all that, rather than working with assumptions. So by the time you put all these things together, you now design exactly what you want and what will solve a problem. You are designing to solve a problem. And when you design, let's say we have a place that is prone to traffic, and you come and design flyover there. And after designing the flyover, there is still traffic. Have you solved any problem? The answer is no. Probably because there are factors you didn't consider. So then, after that, that is the more reason why, when we are talking about those stakeholders at the pre-design stage, these people, like if it is a road, you need to have road safety people, okay? You need to have environmental people. Sometimes if you go to register a project or a building in whether Ministry of Urban Development or whatever development they call themselves, you find out that sometimes they can actually stay in the office and approve. Oh, this is a commercial building, this is a residential building. But you have paid for somebody to come for inspection to now look at what we call the environmental impact assessment. You can't stay in your office and do environmental impact assessment, for God's sake. Somebody needs to come down to the ground and see, oh, people are living here, people are living here, people are living here. If you are siting a factory in this kind of environment, this kind of equipment is going to generate noise, is going to generate carbon dioxide, is going to generate this kind of gas, and these gases are going to have effects on people's lives. The water they drink, the environment they find themselves, the fishes in the river, the vegetations around, animals inclusive. So you see that this is something that sometimes when we say government, I begin to wonder who is even the government. Because sometimes they are working like ghosts. Sometimes, like my colleague there said, Prince, he made mention of writing to some ministries, but who will respond to you? Now, secondly, you talked about coming up with a platform that allows people to aid their view. That is a fantastic idea. But let me tell you one of the challenges. People are in an organization. They understand that they have the right to, complain. There are some agencies created by the government, like ISPON, like Federal Ministry of whatever. There are so many ministries. But then, this person is working in a company, for instance, and it took him years to secure a job, probably where he's receiving a particular amount of money and he's not ready to lose it. Now, he knows that reporting this organization is as good as using your hand to write your resignation letter. So you find out that sometimes these people are either afraid to speak out, or and no matter what you do, it's good to be anonymous. But sometimes, no matter how you do it, people will have a way of finding out, and there is still a way. In fact, as a safety person, as an investigator, if I am working in an organization, for instance, now, and somebody wrote a petition to a company, whether I'm working in your company or not, and I'm invited to come and investigate and find out who wrote that petition, I can look at the content of what you wrote and I will tell you exactly who did that. Because when you are working within an environment, you know everybody's capacity. You know what they can be able to do. So when there is an issue of a staff from the organization reported me or reported the company to so and so, you find out that there is still a way that this can be traced. And it's as good as being sacked. But sometimes, I can assure you that sometimes it's better you are even sacked and you report the right thing. Because by the time you are saving your life, you are saving thousands of people. It has a ripple effect. When an accident occurs, it has a way of affecting a lot of people. So it's very important. Sorry, I'm taking some of your time. It's very important that we look at these things critically from the design stage, from everybody that is involved. My sister there said something about responsibility. Somebody has to be responsible, and that person is you. The change begins with you. The change begins with you. So it's very important that we start it from where we are. What are we supposed to do in the little our house? What are we supposed to do when we come to a public bus? What are we supposed to do when we get to our office? What are we supposed to do before we start talking about government? Now, for the fact that I really appreciate the person, the organizations that set up this program. Of course, we do it a lot. Now, this campaign is supposed to be a government agency campaign. But today, you find out that one way or the other, private organizations are now taking it upon themselves. NGOs are now taking it upon themselves to ensure that people are being sensitized, even at the peak of this. So it's very important that everybody, be it the government agencies, be it individuals, be it you and I, will put our hands together to ensure that safety becomes a lifestyle. Thank you very much.
So much. Thank you so much. Thank you so much, Mr. Max Oneke Friday, for this. In fact, it's like we should just allow him to continue, but because of time and some other people that have other engagement,
yes,
in time, and I've really actually gotten so many information and more knowledgeable Thank you so much. We have been talking about the essential materials in health, safety, and environment to aid efficient operations and growth in the workplace, even in our homes. And we have had speakers who have done so much on the different topics they have looked at. I want to thank everybody that attended. I don't know if Prince want to say one last word. Please, one last word, and just 2 seconds, so that we can just unmute us. Yeah, one last word so that we can go back to work. Thank you so much.
Thank you very much. I enjoyed the program. Yeah, so I think we need to take this into the churches as well and mosques, if they will permit us, so that they can reduce the idea of that God will do everything for you. Even though to put off the fire for you, God will do it. So if we can, because those are areas we can capture them. So if we can reduce those areas, it will go a long way. Then we talk of the 3rd floor. We'll go to fire service. Sometimes I'm ashamed with our fire service men in Nigeria, because I'm trained in the UK and US. So they put a smoke alarm on the wall. So most times I told them, smoke goes up first, not on the wall. Okay, so there's so many crazy things they do here. Then we talk about the Friday, who is an engineer. Let's reduce this burglary of a stuff to a story building, at least, because we've heard there's crime rate in this country. How can you live in 4th floor or 3rd floor? You have a protector there. Who will climb to that place? There's the type of protector you have there just to protect the children, not to fall out from there. But not protector that will stop you from when there's fire event and the fireman, because the only ladder that will get there is the fireman ladder.
Exactly.
The armed robber cannot come with such ladder to even get to 2-story building. Even though in the National Assembly, I don't go, they change their exit ways with chain. The exit way is chain with key. When you ask, they say the person is holding, somebody is holding the key.
The person is not
It's
around.
crazy. If the person is not around, what happened? There's too many. So if we continue today, we will not go. There's too many crazy things. You see. Okay. Like confined space. They are not trained. They don't even understand what is confined space. They don't understand this training for confined space. There's equipment you need to check out the tunnel. There's one I'm doing for one organization in Abuja. There's camera to check the tunnel, whether there's crocodile in that tunnel, whether there's snake in that tunnel, whether there's chemical, there's poison, there's and a lot of things can be under that tunnel you're going in.
Authorized gas testing as well.
Authorized, yeah, you know. Then if it's tank, water tank, iron tank, all these things, a tanker, you want to go in. Sometimes when I see my people, the way they go about safety things in this country, I just say, sometimes I want to go back. I say, okay, let me stay behind to help. So
you need to stay behind to help, because it's crazy down. It's crazy over here.
Then you talk about manual handling. They lift things up to show people that they are strong.
Somebody can even use their teeth to carry bag of cement.
Bag of cement. They don't even understand the position you need to stay to lift something up. Yeah. Secondly, again, they believe, because we have a problem too, because at the end of the pains and deaths, they believe it's their forefathers that killed them, or their uncle or their cousins. So that's why we keep cycling every day. We keep cycling every day, you know. Even though the firemen, they're not well equipped. Most of them die out of smoke inhalation. They don't understand it. The same thing goes to the houses. They don't know that a second, 2 minutes, that's what you have. The smoke will kill you. They believe that the fire that kills, fire don't kill people. It's the smoke that kills you. Before the fire will roast you. You know, so there's a long way. When I go for training to train people on safety, manual handling, sometimes they just look at you as if you're wasting their time. That God, the next thing you hear, God did. You just wonder, God is there. The next thing again, they'll tell you, Omo and water. If Omo and water can put off this thing, please, That is why we have classes of fire. We have class A, B, D, and K. Although we don't talk about K any longer because it's electrical, class C. It's electrical fire. Because today you just need what's it called, a circuit breaker to make sure that those things is gone. So anyway, let's take it maybe next time again. The government is another problem. Like Friday mentioned, we need to start with the government. The hospitals, the banks, they're supposed to have disabled runway. That is the National Assembly, they don't even have disabled runway. So they only believe the disabled is the ones that came from the north. They don't know you can turn disabled from accident tomorrow. Exactly. They don't know you can turn disabled from any kind of accident tomorrow. You can be deaf, you can be blind from any kind of accident. You're not born disabled, but anything can happen. You become disabled. They don't understand it that way. They only believe that disabled are the ones born directly from their mother's womb, and because God will not accept it, that's the point. Yeah. So it's just like when I say this in the government, you talk about DPRO. Look at police stations. Come to Yanitire, or you go to Maryland Junction there. Look at police station, one here, one here, one here, one here. In the same thing go to the farm tank. Sometimes if I go to farm tank to do job, I pray to God. Every second, I pray to God, God, please allow me to go away from this place. Because the tanks are so close. So we have, that's why when Friday was talking about reporting, if we have a place they can report. If somebody walking in a Nigerian brewery, snap a photo of something and just put Nigerian brewery and send there. Or I know we'll get it wrong somehow, but if you go to the hotels, all these big hotels, go behind them. You will not eat the food they serve in front.
Exactly.
If you go to these big hotels, or when our what they call them, NAFDAC go out there, you're supposed to go out to the market to buy the product and test what they gave you at the initial stage. And not going to the factory. Or man, I mention names because I don't care about them. Man will go to the company there. They will, before they get there, they tell them they are coming. They will organize things for them. So many of these people go to some of these motor parks. There's fuel on the floor that will light up fire. And somebody will go there as a fireman, will pass the whole thing. That they are okay, they are certified. Just like the one they do in Lagos here. Every construction company just go there, see sign outside, safety certified. When you enter. Okay, so thank you. Let me just keep it up there from there. Thank you very much.
Thank you so much. It has been an interactive session, and I want to thank everyone. Honestly, I appreciate everyone that attended, both the speakers, those that contributed, those that asked questions. I am sure that questions asked have been answered, and there've been clarity of answers to everyone who asked questions. Once again, I want to thank you, Mr. Max Uneke Friday, for staying up to this moment. I want to thank Prince Ibe for, even though I had to pull him out, he wasn't supposed to be here. I pulled and pulled. He said he wasn't going to be here, but eventually came. I want to thank you. I appreciate that. Thank you so much.
Thank you.
Thank you so much. I also send my greetings or thanks to Famfayo Williams, one of the speakers who has an engagement, and she's left, and Mrs. Antonia Berry. Thank you so much for coming, and all participants, all the attendees. Thank you so much. It's going to be a continuous series, and I hope that when we knock at your doors, you open to us once again for other series. Thank you, and do have a good afternoon.
Okay, thank you very much.
Thank you so much.
Bye.
Bye.